Welcome back, Fading Memories listeners. I always appreciate you tuning in. I have a really interesting topic today. Not that every week is not interesting, and I know I say that all the time, but we are talking about a really early screening for Alzheimer's. And if you know, the earlier we get a diagnosis, the better. So, with me, all the way from Prague, is Andre Ermo of Mamsa, and he's going to tell us all about this new early detection for Alzheimer's disease. So, thanks for joining me, Andre.
Thank you, Jennifer, for actually inviting me and having me. I'm very glad to be here and talk exactly as what you mentioned, that is early screening and early detection, which is oftentimes overlooked. So I'm excited for this new topic.
And the biggest problem with early detection, well, first off, I got this confirmed by guests earlier in 2025. Doctors do not get dementia training in med school, which we need to fix that. But it's the way Alzheimer's and other dementias present themselves can frequently be, diagnosed as anxiety or, you're not dealing with stress well, especially if you have younger onset Alzheimer's or perhaps FTD, and if the doctor kind of goes down the psychological route because it makes sense, because maybe they haven't had a lot of patients with Alzheimer's, although I'm sure that's changing. It just takes longer and longer to get diagnosed. And as hopefully my listeners all should know by now, is the earlier we get diagnosed, the better, because we can implement lifestyle changes that slow the progression. And there are new treatments and there's other things in the pipeline. So early diagnosis is super, super important. So why don't you tell me what you guys are doing? Because I think you guys might have like the earliest possible warning diagnosis out there, at least as far as I know.
Well, I would be very happy if that was the case. Although it's the type of bittersweet happiness, because I wish there was someone who was much more ahead of us. But what we actually focus on at Mamsa is developing screening for Alzheimer's, but not only as Alzheimer's. Of course, it's also mild cognitive impairment that's even more important to diagnose, especially when we talk about early from voice. And part of what you said is well defined problem is that doctors don't really get good enough of a training for the diagnosis. But I would say that just this, even that's the smaller part of the problem. Perhaps the bigger part is all the other uh, obstacles on the way for the patient, for the senior, nowadays not even a senior, to get diagnosed. It's oftentimes infrastructural. It is monetary, of course. It is the financial issue as well, to access good quality healthcare, and it is also the preliminary fear that we oftentimes meet. So when I would jump into the topic of Mamsa and how we actually got there, because it is perhaps to some quite unusual that people in their 20s, as our entire team is a bunch of 20-year-olds working on the early diagnosis of Alzheimer's. We actually started with a slightly different problem, and that was, uh, if I simplified, it's the pandemic of loneliness that's spurred out of COVID-19 and the disillusion of social bonds, especially among seniors, and how it contributes to chronic diseases and basically worsening across all aspects of life and health. And so we started working on a product that was basically digital over phone reminiscence therapy. Uh, I would think that also for your listeners, reminiscence therapy is nothing, greatly innovative. It's something that's been around and well known, pretty well explored and documented since 80s. But we try to take it with a bit of a new spin, and that is again to uh, remove the obstacle of having to go to see a therapist, to have it on the phone, always available. You just dial it up or set up regular sessions to keep talking, keep reminiscing, and as a form of cognitive practice. And we started working on the key idea that we sense that is absolutely needed in the product, and it is, how do you know if it's working, or how do you even know whether you are not declining further, right? Because without having any feedback loop, it's just a bunch of empty promises. Let's put it that way, right?
Yeah, that makes sense.
It's just right. So
Mhm.
we started exploring this option of how could we, from having available only the voice data, nothing else, no visual aspect, of course, no camera, no recording, I mean facial recording, no doctor on the phone. We only have voice. What can we actually do with it? And so we started working with a partner. It's a deep tech company that focuses quite discreetly on the voice as a source of biomarker data for in healthcare. Works with major insurance companies, with large hospital network, and we started dealing with them in a sense to find out whether there is a product out there, or whether there is a technical solution out there that would be able to detect Alzheimer's and, of course, mild cognitive impairment just from voice. And luckily, uh, it is also like slightly bad for us, but I'm happy for the market that it is not the only solution, right?
Right.
There are multiple companies doing this, for which I'm grateful for, and I'm happy about it, because nothing helps the sector more than healthy amount of competition, right? That's generally what tends to make us all work a bit harder. So we actually started by implementing the voice biomarker screening into the reminiscence therapy, but soon realized that it is quite an important product on its own, without needing a different platform, reminiscence therapy, etc. And so we started developing that further. And at this point, I'm really happy that the voice biomarker technology, it's not a bunch of empty promises. There are clinical studies on it. It is also covered by Medicare, Medicaid. It's a official tool that doctors across America and other states use and can use to boost their own performance. As you said at the beginning, you know, medicine is still about people, and luckily, hopefully, will be. So I don't think that we're trying, or any company is really trying to replace the doctor. I think what I really like to see as the trend that Mamsa is working with, and is kind of riding on the wave of, is giving doctors the tools to basically enhance their capabilities, their capacity, and voice biomarker technology is definitely one of them, where you see, and I don't want to get it too much into the nits and grits of it, though I find it interesting. I don't think that's necessarily where the value lies, but especially with like early detection at the stage of mild cognitive impairment, doctors don't have a good track record of noticing it, and I don't blame them. It's just very minor signs and signals that probably you would need to spend maybe not even hours, maybe days with the person to really notice in the everyday life, especially as you definitely know it also comes in certain cycles. And if the patient is seeing the doctor in the time of, let's say, in the good time of the day, there is no way on earth for the doctor to be able to notice during the short visit.
No, not
This
at
is
all.
basically, what we're trying to prevent, and giving doctors this high precision tool that has basically 94% precision of detecting mild cognitive impairment, and of course, when it comes to Alzheimer's, it's even higher. So I think that's those are fabulous numbers that I always like to mention, because there are tools across that are great compared to human efficacy, but they go somewhere around 56%, 60%, which is still an improvement compared to human performance. But especially when we go like above 80 and above 90, that's I think it's one of the greatest things that I see as the current development in healthcare.
Yeah, well, you made a really good point about people with mild cognitive impairment are even harder to diagnose because you've got probably more time during the day when you're good and probably not going to the doctor and when your cognitive performance is dipping, which is probably end of the day after work. I know one of my past guests, her husband's had mild cognitive impairment their son was in junior high and he's been a lawyer with the military for 2 or 3 years. So we're probably closing in on 20 years and he hasn't progressed. I also recently met a gentleman who was diagnosed with MCI and went on a clinical trial for lecanemab, and you would not know 10 years later that he has Alzheimer's because of the early intervention. So helping doctors get to that point where they feel confident. A lot of doctors, they're like, yeah, maybe I think they might have it, but there's nothing we can do, so I'm not going to tell them. That's still kind of, I think that problem is going away, but, giving them tools to help is definitely, and you're probably aware, but if you're not, people with Alzheimer's, even in the, earlier and middle stages can do what we call like showboating, which is they act perfectly normal for a doctor or some other person, and their mind is terrible with you, but you go to the doctor and they're performing really well, and you're saying, but this, that, and the other thing, and the doctor doesn't know which one of the two of you has a mental problem. I've heard those stories so much over the past, I don't know, 20 years. It's just it's funny, but it's not funny because, the doctors only have a certain amount of time. And if your person doesn't look like they have a problem and you kind of look like you have a problem, it makes it hard for everybody, which is why I always tell everybody that I meet, if you have concerns, either start making your own notes, but if you're concerned about a loved one, keep notes of what's going on, date, time, place, circumstances, and you'll have this notebook with maybe the voice screening. It's just more evidence to give the doctor because that's what they need for a diagnosis. They can't just be like, "Oh, yep, I think I think you've got a problem."
Yeah.
So how?
Oh, absolutely. And maybe to that point, I would jump in. I think it is absolutely a problem, but it is also connected to the fact that how stigmatized Alzheimer's is, right?
Yep.
And that is understandable that people really are trying to avoid the diagnosis because because of the way it's been talked about and the reputation it has, believe that there is really nothing on the other side. As with many diseases nowadays, if you get diagnosed, you perceive it as a rather positive thing, that you can get effective treatment that can improve your state. While with patients and seniors who fear Alzheimer's, they on the other side of the diagnosis wall, they see being put in memory care, further away from their family, no really efficient drug on the market that is like publicly known. So I think part of really what is being fought here is not only the disease itself, but the public image that's been built around it as this, almost like a punishment from that was just sent down from heavens, that there's really not much to do about it, and we know almost nothing about. And I think there's just such a tragedy that this is still the narrative, because they're really looking at all the factors and great studies like the finger study and many other across the world, and they really point out also to lifestyle factors that influence it greatly. I think that is, to myself and many many patients and family members of patients with Alzheimer's disease. I think those studies should be or could be a great source of hope.
Yeah, I try to talk to as many people living with the disease as possible. Um, there's an episode that came out right before this one that talked to a gentleman in the UK. Like I get to get up early regularly for some of these, and he has been when he was diagnosed. He said, took him a while to get through the depression and the fear and all that stuff. He was diagnosed with mild cognitive impairment, and he is a cyclist, and he rides his penny farthing as a way of helping people learn about the disease and help destigmatize it, which I think is great. And I've talked to them 2 or 3 times. And even though he has to talk to me late in the evening because it's after breakfast for me, you wouldn't know. Like, he probably doesn't remember the conversation when we're done with it, but during the conversation, he's still really good. So that just shows that an early diagnosis and lifestyle interventions like cycling is really good for your brain as long as you don't crash. Because I crashed years and years ago and cracked my helmet all the way through. So I'm very adamant on the ugly bike helmets. But everybody I've talked to that's still living well with the disease was diagnosed relatively early, and they're doing the lifestyle interventions that we all should be doing every single day. And everybody that listens to this regularly should know all what they are because I repeat them all the time. So we won't go into that part today, but how do you get biomarkers just from a voice recording?
Yes, that's actually a fascinating question. Because we tend to think of biomarkers generally as something out of a blood screening, right, or blood works. While those are, of course, those are biochemical
Mm-hmm.
biomarkers, but however, we have all kinds of biomarkers. Basically, biomarker can be anything that is indicating the state of your human biology, right? And we can source them visually. For example, if you would, of course, make screening uh, of your skin or of your eyes, coloration, etc. And of course, using this logic, we can also get them from voice. The key aspect of biomarker and what it makes a biomarker is that it needs to be precise and objective, right? Because when we think of speech, or there are also other tools that work with speech as it is, that is not really a biomarker, because evaluating from just whether your speech is fluent and whether you use filler words, those are not biomarkers, as they're quite soft rather. But when we look at the voice from the perspective of Alzheimer's screening, we really break it down into its basic physics, waveforms, and it's just numbers. It has nothing to do with the voice itself anymore. There is no listening being done. We do not take into consideration any aspects of speech, of what you are saying, or what's the tone of your voice, or any of these, let's say, human aspects of voice that are, again, soft. But we look at it just from numerical perspective, and we break the voice down into 10 millisecond segments. And for that reason, we only really need 45 seconds of spontaneous speech, of you just talking about anything, no vocal exercises. And from that, we have enough data to actually do the analysis with confidence. So it is hard to imagine what precisely even the biomarkers are, right? So for example, it is not I oftentimes meet people who kind of assume that we are measuring like pauses between words and pitches and other aspects. But again, that's speech, which is not a biomarker. But Instead, uh, there's a set of 700 different measures that are present in every of those 10 milliseconds of your voice that are measured with specific value. And actually, which I think is also a very interesting niche on the market, is that use our technological partner using those same measures, those 700 measures, maybe different, maybe a bit more or a bit less, they can actually screen for and diagnose all kinds of other diseases and conditions, whether it's Huntington syndrome, Parkinson's, anxiety, depression. Last time we spoke, I know they are also developing and working on aggression model, autism. So I think it is an important to mention that human voice is really a great source of medical information and medical data for the way it reflects our neurology. It is so connected with voice. And, we could even go to anecdote, like you can hear when someone is sick, and you can hear all these things. And that is just with our very imprecise measurement of it. So once you start really getting into the nits and grits of measuring with precision, every 10 milliseconds, 700 different factors, you can learn a lot about health, about what is going on the inside, on the neurology, neurodiversity of the person, bodily functions, etc.
Wonder if that would have helped me. So I was having issues with my voice, just like I would do a recording like this and my throat would just be so tired. It turns out that instead of projecting from up here, your head, like the hollow part, I guess it's not really hollow, but kind of where the sound resonates, I was squeezing my vocal cords for all they were worth to project. And I worked with a speech therapist a little over a year ago. It was funny because the ear, nose, and throat doctor said, he dismissed a previous diagnosis from a different ENT. And he says, I just think you don't know how to talk, which was hysterical because I do it all the time. I thought I was doing just fine. And then I worked with her and we realized really quickly that I was like strangling my poor vocal cords. And what's interesting is at the beginning of the 5 treatments and the end, we had 2 different recordings, and my voice did change a little bit. The pitch was just a little bit different. I don't know that listeners would be able to hear it because I think it subtly changed for the worse and then got better. But yeah, it's really interesting what your voice can show. It's like I was going to ask, it seemed like it was diagnosing all the neurological diseases, but you commented on that. So it was very interesting. So do you think if I gave you like a recording from when my voice was like really, really tired, do you think you might get a false negative? Because I was
No,
no?
I I don't generally, of course, what can intervene with the precision of the analysis is different respiratory issues and diseases. And that is, of course, because it changes the breathing, puts all kinds of strain on your on bronchi, and just messes up with the way a person speaks. But even that doesn't necessarily produce a false positive or false negative, right? What is actually an interesting factor that plays much bigger role is being under influence of anything really intoxicating, because that also greatly changes your neurology, especially considering alcohol is a depressant, but also stimulants can mess with the way your brain operates, your nerves work, and that of course impacts the how your voice behaves. So that I would say is much stronger of a potential issue in the analysis. But we always try to communicate it very transparently and put lots of emphasis on it, because of course, you know, as with everything serious, false positives are an issue that we're trying to avoid, as we don't want to give anyone a heart attack in the process of getting mild cognitive impairment diagnosed.
Yeah, for sure. Would sleep deprivations of being really tired? I recently went
Yes.
back east. Yeah, because oh my goodness. To get to this conference and not fly through an airport that you are almost guaranteed to get stuck in, you have to take a red eye. So I had to take a red eye from Sacramento to New Jersey, and I got to the hotel at 9 in the morning. I had breakfast, and of course, that early in the day, the rooms aren't ready, and there wasn't really any appropriate place to take a nap. So I was basically up for 24 hours or more. And, being old enough, because I just had a birthday, it took days to you can't catch up on sleep, but it took days to
Yeah.
re-regulate. And there was just times when I would be speaking and it'd be like, that word does not want to come, or I'd trip over words. It's like you could tell something was going on. And I knew that it was sleep deprivation, but it's just amazing how just like something that small, because of course, you get to the conference and you're already a little sleep deprived, and then it's full steam ahead for 3 days. It's like
Yeah.
crazy. So that's interesting. So don't drink. Make sure you're well rested. That's
It's yes, and actually for that reason, you got it precisely as it is. Being, sleep deprived, especially as the age progresses, will impact the results significantly because it directly impacts cognitive performance. Sleep is probably the most directly linked to it in the short term. Now we also know that it is also in the long term. But for that reason, we also measure other indicators that could give us more context into why is the result the way it is. And of course, we measure also things like depression and anxiety to understand the context a bit more if it's necessary. And we also measure different biomarkers for energy. So if we would spot that the result, let's say for MCI, turned out positive, but we also see that the person's energy across the markers is very low, we would in that case recommend retaking it in 2 weeks, because especially if you're in not even 76, in 50s, and you didn't sleep well because of a back pain, night or 2 nights, 3 nights in a row, it could definitely impact the result of a cognitive screening, whether it is our cognitive screening from voice biomarkers or the performance or the screening done by a doctor.
it just shows how important sleep is for our brain health,
Absolutely.
which
Absolutely.
is interesting. I do know why sleep is important, which we've talked about previously on other episodes on brain health, but it's interesting that we're talking about a voice screening, but being overly tired could give you a false positive, which we don't
Right.
want, because that's terrifying. That's just, I find that really interesting. So is there any
Actually, the issue is that it is not even a false positive, because if we are because it's in the core we are measuring cognitive markers or neurological markers that all 700 of them combined with special measurement define the disease, right? So in that specific moment, your markers are those actually of a person with the diagnosis with Alzheimer's disease or mild cognitive impairment, but you don't have the disease because you don't have it long term, right?
that makes sense.
So,
I definitely
so
felt like I had mild cognitive impairment after getting home from that conference.
Right, exactly. So that's actually maybe it's even the different of an issue, because false positives are really scary, right? And they are, let's say, the devil in these types of tests, because they are surely false, right? But there are also across other, even blood works,
Mhm.
you could have a hormonal test done after a weekend of, let's say, after a wedding, poor sleep, some alcohol, maybe you had more cake, more sugar than you should have, and that will impact your hormonal results maybe on the Monday. So you will actually classify as this is uh, the issue that the doctor could diagnose you with. But the problem is that it's very short term. So that is even possibly a bigger issue when it's not false. It is just short term, if you know what I mean.
So basically, I did have mild cognitive impairment after the conference, but I don't have it now because
Right. You had the symptoms of mild
exactly.
cognitive impairment, right? But not for it to actually be MCI, it would have to be long term, constant, etc.
Well, thankfully, it's not still occurring. My brain is working fine now, but it's just interesting how being less rested, because I didn't feel sleep deprived after a day or so home. The problem is I got home at midnight and I had to leave at like 11 o'clock the next day. I wasn't even home 12 hours and I had to go do a program for the Alzheimer's Association. And all I wanted to do was like stay home, wash clothes, and get my life back together slowly, not get up, do my morning routine, run out the door. It's just like, woo. So I think it took a couple extra days just because I didn't ease back into my normal schedule. But yeah, it was just like I would say something and it would just come out goofy or just wrong. And they'd be like, oh, I hate it when my brain doesn't want to work. I mean, I knew what was going on, but
Yeah.
I think people with MCI aren't always aware that they're having an issue. Um, Feel free to email me if that's not the case for whoever might be listening, because I'm interested. So, do you know how they discovered that they could take the um, audio wave
Mhm.
image and actually diagnose neurological diseases? Because that fascinates me to no end. Like, how did they
Yeah.
figure that out?
I mean, it is something that's been, many companies been quite invested into that over the past, how do you say, since the mid 90s, as the voice technology progressed. It is kind of the same field as the entire voice uh, recognition, and using it to identify yourself in a bank, etc. To use it as a because basically uh, it is quite the same technology when the voice recognition, and that is because even in that case your voice is broken down into the objective measures, into the same way if you would scan your fingerprint. It's broken down into the individual distances between the lines on your fingers to the fractions of a millimeters, to have 100% verifiable source of data that it is you. And it is same with voice. And using this data, people and companies, research institutes, been playing around since basically the establishment of this field, to figure out what else does it tell about the human body. Of course, we found out pretty early on that every voice is unique, not in the sounding, but of course that it can be used as a unique identifier. And that is, once a person truly realizes what that means, how much data it holds for it to be unique among those, you know, 8 billion people. It's an enormous amount of data that is coming from somewhere. It's coming from neurology. It is also reflecting hormonal changes in the body. There's no, there's again no needs to be a scientific genius to figure it out just by listening to a person going through teenage years. and and also many companies, Amazon has invested into that, and luckily I would say in this case and in many other cases, it's been done through good old clinical trials.
That's fascinating.
So for example, I know that our tech partner, they actually started with the first trial ever run, of course, on a different model than the current one, was done in cooperation with an insurance company, right? And why insurance company? Because they had both the voice sample of people calling in as well as the diagnosis match in the system. So you, of course, erase all the personal identifiers, and you just have again the biomarkers, which are just numbers, no voice, no words, no nothing human attached to it, and then you have a diagnosis in the system: Alzheimer, positive, negative; diabetes, positive, negative. And then, of course, through data science, and you go through it and find patterns, right? So most of the research has been done actually in this way of kind of reverse engineering voice into finding out which biomarkers mean what diagnosis, rather than starting on the green field and like now we're going to find out what does a voice that has Alzheimer's disease sound like, right?
That makes sense. That's just so fascinating. I'm always impressed with people whose minds think that way. Mine does not think that way. So I'm always impressed with people who, I don't know, whose brains think like that. That's really interesting. So if somebody listening, maybe because most of my audience are caring for somebody that probably is diagnosed or for sure has an impairment of some kind, even if they don't have an official diagnosis, maybe they're worried about themselves. What should they be doing to hopefully alleviate concern or find out, yes, I'm headed down that path. Let's find out now so we can start the lifestyle interventions and do the things that are definitely have been clinically proven to help. Where should they go?
So, of course, when I put aside the obvious answer, which is to go to mamsacare.com, which is definitely one of the options, but I think that the best practice when I don't want to make an advertisement here is to just like self-observe and make that a regular habit. Make it a regular habit to journal about it, write it down. We all know, I know it on myself, that the short-term memory, especially about these minor things, works very differently, especially when you're trying to think like, did it really happen? Does it happen like every week? Or was it just, when was the last time it really happened? Also the significance of those events kind of tends to be minimized over time, or the perception of it. So I would say that is the best measure out there, and not only for Alzheimer's, mild cognitive impairment, cognitive decline, but in general, because the biggest problem, if we would talk about the fact that right now we have tools like Mamsa that can diagnose, that can screen for MCI or Alzheimer's relatively effortlessly from home, 45 seconds of voice, relatively cheaply. We are eliminating many of those barriers and uh, you know issues that would prevent people to get the screening or the information they have a problem that would prevent them before. But the biggest issue that we haven't solved yet and will be very difficult to solve is to actually make people search for it. The the internal input either from themselves or from their family member to actually start searching for a solution or start searching for the answer. And so for that, I would say self-monitoring, self-observation, and journaling would be probably the easiest and at the same time the hardest solutions, because it is definitely not an easy thing to do regularly and then to go through it, etc. But compared to all the other things that I could be talking about, regular checkups, and probably and ideally getting a second opinion too, and talking to doctors that use different diagnostic tools, and you asking your family members for their honest opinion, whether they noticed it or not. And I could mention lots of other things that could and would probably solve some of it, but I think the self-observation precedes all of them.
That makes sense. And you're kind of writing down like your observations. So I got home from the conference and I knew my brain was not firing on all cylinders. I could have written that down because most of my listeners know, you probably don't. My mom had Alzheimer's for 20 years. My maternal grandmother had vascular dementia. My maternal great grandmother had some form of dementia. So I would believe it would be easy for me to not catch issues. And that's where asking somebody else, have you noticed that I'm forgetting more, or, having trouble with words more? This goes back to the 10 warning signs of Alzheimer's. You can look that up on the Alzheimer's Association website. I'll try to remember to link that in the show notes because it's really fascinating. But I think having a journal, a notebook of situations and what's, like what was concerning? Why did you write this down? Or what, or you see a pattern because you kept track every day, which would be fantastic. And then also maybe this biomarker test, and you take it to your doctor, that gets them maybe to step 2 or 3. I would assume at some point they'd still want to do a PET scan.
Yes.
I know that there's the blood biomarker test that they're really pushing for, because general physicians can do that in their office and not send you to a specialist, which, we all know the American healthcare system is not great, and having to go to specialists is a barrier because sometimes your insurance doesn't want to pay for it. So I think even if you got a positive result, to me, it's information that you can then take, and hopefully you'll get connected to a doctor who can send you to somebody that can help you
Absolutely.
with, your cognitive health going forward. Because as I've talked to and demonstrated on this show and other places that I speak, people are living pretty well with this disease, and they're slowing the progression. And if you are diagnosed, say in your 80s with MCI, and you slow the progression, the chances are you will not end up in a later stage of the disease before you pass away, just because, I think that's kind of fairly understandable. So I don't want I don't want to dwell on that part too much. Is there any last little tidbit of information? Mamsa's website is always in the show notes, so you guys can go and check that out. But is there anything else you want somebody to know before I let you go and enjoy your evening? And I'm gonna go have lunch.
Yeah, that's. I think many of the important things been already mentioned. I really think it's great that the topic is opening up a bit more, democratizing in a sense that we are no longer just relying on, I would say, the top authorities to have monopoly over the topic, which of course sometimes is nice, but most of the times I wouldn't say it's a benefit to have it so monopolized, the discussion. So podcasts like yours I really find great because it brings the topic closer to the people, brings information closer to people is also how I got into into the topic myself. And I would just say that I am greatly, and I know it's always sounds a bit weird to be saying this about about a disease like Alzheimer's that is so devastating, but I am greatly excited about the developments ahead, because sometimes especially when I go to certain conferences or meet people from medicine, there is you probably know that better than I do. You know, in 90s there was this concept of like the end of history.
Mm-hmm.
You know that we basically reached it all.
Yeah, they thought that. Of course,
Right.
a lot of people thought the world was going to implode, and when we went from 1999 to 2000, that's like a whole other story. Is we didn't know.
Exactly, right.
Well, my husband worked in banking at the time, and we ring in the new year, and it was January 1st, 2000, and he's like, "I'm gonna go check the ATM and make sure it's not like spitting out money or." They didn't know what was going to happen, and it's funny to look back on it. We were in such panic, and it was completely no big deal. Now they did work on fixing the problem with the date. They were afraid that the computers were going to roll over and think it was 1900, and I don't know. It's kind of funny to look backwards and think, "Oh my gosh, we were so worried about that." But yeah, they did think that we'd kind of achieved a certain level of humanity that we might not surpass, and I think we have, thankfully. So
I think every single day we are finding out that we don't know just so much,
yeah.
and there is still so much to explore, discover, and find. That gives me the sense not only of excitement but of purpose. I think it would be greatly depressive of a life to live in a world where everything is known, discovered, and explored, for perhaps for younger people. So so yeah, I think it's connected with hope and purpose. And maybe last thing, for anyone listening to that would be interested to take the test. I know you've mentioned, Jennifer, that it will be in the link, and for all the listeners that made it this far, if you use the code Fading Memories, we'll give you 50% off the entire tests, which I think will make it even further affordable if anyone is curious and interested. So yeah, that would be the
Well, I appreciate that. That's very generous, and it gives people now know what they should be doing the start of a new year and taking care of their brain health. And I agree with you. I've always felt that, you know, they they kind of say that space is our final frontier of knowledge. I totally disagree with that. I think we know more about space than we do about brains. So it's going to be a race to see, do we discover more about our universe or our brains? Because they're kind of similar. But yeah, I've always felt like the final frontier is knowledge of our brains. So you guys are trekking forward on that one. And
we're trying the best.
yeah, I'm kind of excited because there wasn't anything there wasn't any options for my mom, and she was really big on denying and avoiding getting diagnosed because she knew what it looked like, because all she had to do was look at her mom. I would like people to hurry the heck up because I'm not getting any younger. But I've learned so much from talking to guests like you, and I do all the brain healthy stuff that I can possibly do in a day. And so I feel like I'm probably the close to the end of the population that has less hope if we end up with some form of dementia. But I'm right at the beginning of there's all these other possibilities. So
What is the best part of your healthy brain routine?
well, I exercise every day. I eat really well, which is not cheap. And I have some it's like eating healthy is expensive. It's not fun. But it's one of the things that I do that I like a huge amount of variety. and I get bored. Like there's times when
Mm.
I'm hungry, I'm very, very hungry, and nothing sounds good to eat. And generally, people will tell you, then you're not really hungry. That's not the case for me. My brain is just saying it wants, I don't know, something it hasn't had, or it's kind of frustrating. So I have taken to use
Dopamine seeking, right?
yeah, I use AI to pair. So I will tell it, here's what we're having for dinners this week. Give me some good, unique side dish options. And I have learned some really good recipes and made meals more interesting, more flavorful, more enjoyable. And I think I think it feeds my brain because my brain is like, bring on the interesting, the fun, the different. And then
Yeah.
I mitigate stress and frustration through creativity, which anybody that listens regularly should know that any form of creativity, dancing, singing, playing a musical instrument, drawing, painting, whatever, fires up all the regions of your brain,
Yeah.
and it's meditative. So it's excellent for your brain health. So that's pretty much what I do every day. And I also do it for my aging golden retriever. His dog's
Like
dementia. She gets regular walks, she gets stimulation, so
it's good.
well, I appreciate this. This is really fascinating, and I'm kind of excited to be on like part of this cutting edge new phase of dealing with and living with some form of cognitive disease. I hope people check out mamsa.com. Like we said, that's in the show notes. And hopefully
Care.com.
oh, Mamsa Care, thank you. It's a good thing I always look it up before I post it. And, hopefully you won't need it, but if you do, they're there and
Exactly.
I appreciate it. So thank you for joining me from all the way from Prague.
Thank you very much, Jennifer, for actually inviting me. It was a pleasure.
Thank you.